Yes, we are ready. Can you count down one more time just so they know?
Have we got everybody, or should we wait a minute? Elia, you tell me.
No, we're good to go. Thank you.
Good afternoon and welcome. I want to call to order Subcommittee on Oversight. Thank everyone for joining us today. We are holding this hearing virtually. If you didn't realize it, in compliance with the regulations for remote committee proceedings pursuant to House Resolution 965. Before we turn to today's important topic, I want to remind members of a few procedures to help you navigate this virtual hearing. First, consistent with regulations, the committee will keep microphones muted to limit background noise. Members are responsible for unmuting themselves when they seek recognition or when recognized for their 5 minutes. Second, members and witnesses must have their cameras on at all times. You need to step away from the proceedings. Please leave your camera on rather than logging out. Third, we will dispense with our practice of observing the Gibbons rule and instead go in order of seniority for questioning, alternating between minority and majority, beginning with members of the Oversight Subcommittee first. Finally, without objection, Representative Chu is authorized to serve as chair in the event that I have some technical difficulties or for whatever. I thank you all for your continued patience as we navigate this technology in order to continue serving our country together in this great time of need. And with that, I will now turn to the important topic of today's hearing: maximizing health coverage enrollment amidst administration sabotage. It sounds like a movie. So good morning, everyone, or good afternoon, rather. Our hearing today will focus on access to health coverage and the Trump administration continued unconscionable sabotage of America's care. Since its passage over a decade ago, Republican leaders have treated destruction of the Affordable Care Act like Captain Ahab treated the white whale. Since 2011, the other side has voted more than 70 times to eliminate the ACA. In 2017, they even held an outdoor party at the White House after passing a plan that would cause millions to lose their health care coverage. That same year, one of the gravest abuses of power in this era, in the dead of night, Republicans came within one vote of ending the ACA and remaking 1/6 of the American economy on a bill they'd introduced hours earlier. The president recently bragged about his health care. Of course, he has great coverage paid for by all of us, by the same taxpayers who stand to lose their protection if the administration succeeds in the courts. They've never let up. I just want to remind everyone, the administration is in court right now demanding to destroy the ACA. The administration is fighting to remove health care programs and protections from millions during a pandemic. They're using virtually every tool to dismantle the healthcare system. They have greenlit scam junk plans without any protections. They've imposed a gag rule to prevent women from having access to reproductive health care. They have gutted funding for navigators and assisters. While failing to crush the ACA, they are destabilizing the American health care system to a breaking point. The administration has gone out of its way to prevent Americans from getting and maintaining coverage. Between February and May of this year, 21.9 million workers lost their jobs. Of these workers, 5.4 million became uninsured due to their job loss. In March, I joined my colleague, Health Subcommittee Chairman, Lloyd Doggett, and nearly 100 House members calling for a special enrollment period for people to seek ACA marketplace coverage during the COVID-19 pandemic. Even during the pandemic, HHS refused, likely dooming many Americans to suffer. No other word that I could think of except sabotage. We keep seeing the administration and my friends across the aisle swear up and down they support protections for pre-existing conditions. They assert with a straight face while spending 10 years attacking the ACA. Let's repeat, the Republicans have sought to terminate pre-existing protections over and over and over again. It's on the record. In welcome contrast, some states are working hard to expand access to coverage. One of them is the great state of New Jersey. We have witnesses today from New Jersey, Colorado, who will discuss how they are making the ACA work best for their citizens. As Senate Republicans race to confirm a new justice, they are downplaying their challenge to the ACA. If the Republicans have changed their minds on the ACA, why would they join us in defending the law? When we voted in June to protect the ACA, 177 of 179 Republicans opposed it. If you don't have a calculator handy, that's 99%. When given a chance, 99% of our colleagues across the aisle voted against protecting pre-existing conditions. We know why. In just a few short weeks, the Supreme Court will hear the ACA case. The future of our healthcare system hangs in the balance. And I want to yield now to my good friend, the ranking member, Mr. Kelly of Pennsylvania. And I'm going to keep it to 5 minutes because we saw it happen the last time. Two people went over, Republicans and Democrats. We talk too much, Mike. Okay, so Michael, you're up.
Thank you, William, and thanks for holding the. This is really a tough time, so I think all our thoughts and prayers go out to anyone who's lost a family member or a loved one during this virus. There's nothing been more devastating in our time than the China flu. And during this time, the cost of healthcare is on the minds of almost every American. So I appreciate the opportunity to really discuss the issues today. Now, while far from being perfect, our healthcare system is the best in the world. And with a hearing like this, I'm also reminded of how fortunate we are to live in a country with access to the most innovative healthcare on the planet. Now, I hope we can use this hearing to put things in perspective and correct some of the myths about the American healthcare we have been hearing we're having a hearing on the campaign trail. Today, I want to talk about two things. First, I want to talk about some successful healthcare policy developments we've achieved over the last couple of years. And second, I want to correct the record on some of the rhetoric we've been hearing about American healthcare. A lot of this rhetoric seems designed to scare the American people in advance of an election. And I think that effort has been both unfortunate and very misleading. The idea that this administration has sabotaged our healthcare system, if that's the truth, this is the worst sabotage the world's ever seen. It has been. I can't actually look at this and say, come on, if we're really going to fix this, let's fix it. Let's not talk about things that sound good on the campaign trail but ring hollow when it comes to truth. We've made some very positive progress on stabilizing the ACA's exchanges. Insurance premiums are down, coverage choices are up, and enrollment is stable. So in addition, this administration has made many strides towards being more affordable healthcare options to Americans who may not want, need, or be able to afford some of the ACA's coverage plans. So I'm pleased that we have Chris Pope here with us today. He can speak further to some of these successes, including the restoration of short-term healthcare plans and major enhancements to health reimbursement accounts. Now, these crucial events or reforms have actually provided options to family, letting them choose what's best for them. Again, emphasizing letting them choose what's best for them and not having something shoved down their throat that they don't have a choice in. Now, let's also remember that by getting rid of the individual mandate, we've saved lower and middle income taxpayers at least $695 a year. And that's huge when you look at that group of people. Now, Democrats have been trying to block these efforts, and I understand why, and also using scare tactics to stop the progress of this administration. Well, what tactics am I saying or talking about? Well, like saying that Republicans would eliminate coverage for people with pre-existing conditions, which couldn't be further from the truth. On protecting pre-existing conditions, Democrats won't take yes for an answer. Makes no sense to me, but that's where we're at. Now, let's remember the first legislation offered by Republicans in the 116th Congress said no one, and I mean no one, should be charged more or denied coverage based on their pre-existing conditions. Democrats rejected that offer, apparently to try to preserve it as an election issue. So any suggestions that Republicans won't fight to protect Americans with pre-existing conditions is just flat out wrong and a great miscarriage of the truth. Meanwhile, instead of working together on bipartisan efforts to improve our healthcare system, 118 Democrats have co-sponsored Medicare for All. This new and enormous program would destroy our current healthcare system, starting with the repeal of the Affordable Care Act. Sadly, many Democrats simply want an unpopular and partisan government takeover of healthcare when we should be working together to low costs and coverage for everybody and get more options to the American people. Now, this one-size-fits-all approach is absolutely wrong. It doesn't make sense to anybody other than somebody trying to push an agenda the wrong way. Now, the plans that will take away choice from hardworking Americans in my district would also destroy their health care options. The Affordable Care Act is 10 years old. Much of that law has changed over the last 10 years on a bipartisan basis. Yet Democrats keep looking to the past rather than working together to improve the future for our American people. But we can build on recent successes in healthcare policy by continuing to bring down premium prices and by increasing coverage choices for all Americans. The key is increasing the number of options available, and people can actually buy something that fits their needs and something they can afford. Now, I hope we can stop all the fear mongering on this issue and come together in the near future to work on bipartisan reforms that will improve the lives of our constituents. Mr. Chairman, I want to thank you for holding this hearing, and also want to thank all our panelists for taking time out of their lives to come and talk with us. So thank you so much, and I yield back, sir.
And say to you and to all the Democrats and Republicans who were on last week with our last hearing, not this hearing, I thought going over everything after the hearing, tremendous questions from both sides of the aisle on the subject of taxation, tax fairness. I think that, it's tough to get people together before an election, but I want to compliment both sides for doing what I think was a spectacular job. We're next going to hear from our panel, and thank you to our distinguished witnesses for taking the time to appear before us today to discuss this very important issue. I'll introduce our witnesses and then turn to each of them for their testimony. Our first witness is Commissioner Marlene Caride. She is the commissioner currently leading New Jersey's Department of Banking and Insurance. Previously, she was a member of the New Jersey General Assembly, representing the 36th Legislative District. Our next witness is Kevin Patterson. Mr. Patterson has served as the Chief Executive Officer of Connect for Health Colorado since April of 2015. He has a long history of public service, including as interim Chief of Staff to Governor John Hickenlooper. Our third witness is Andy Slavitt. Mr. Slavitt currently serves as the board chair for United States of Care. Previously, he was the former acting administrator for the CMS. And our final witness is Chris Pope. Mr. Pope currently serves as a senior fellow at the Manhattan Institute. His research focuses on healthcare, payment policy, and insurance market reform. Each of your statements will be made a part of the record in its entirety. I would ask that you summarize your testimony in 5 minutes or less. To help you at this time, please keep an eye on the clock that should already be pinned to your screen. If you go over your time, I will notify you with the tap of my gavel. Commissioner Paridi, you may begin.
Thank you, and good afternoon, everyone. Thank you, Chairman Pasquale, Ranking Member Kelly, and members of the committee. As mentioned by the chairman, my name is Marlene Caridi, and I am the Commissioner of the New Jersey Department of Banking and Insurance, and we regulate the banking, insurance, and real estate industries, and now operate Get Covered New Jersey, the state's official health insurance marketplace, which launched this month. Under the leadership of Governor Murphy, New Jersey has led in protecting the Affordable Care Act, stabilizing its insurance market and increasing access to coverage based on the guiding principle that healthcare is a right. The state has moved in a deliberate way towards where we are today, opening our state-based exchange, making coverage more accessible and affordable for our residents, and providing more financial help than ever before for those purchasing coverage on our marketplace starting this open enrollment. In 2018, the state enacted two major policies. We took first in the nation action to continue a requirement to have coverage after its elimination from the federal level. And we implemented a reinsurance program beginning with plan year 2019 to cover high-cost claims, reduces rates in the individual market. The two laws resulted in health insurance rates in the individual market that were 22% lower than they would have otherwise been. The state decided to establish its own marketplace in order to better secure access to affordable quality coverage for our residents. The fact is that while we have been sending funds to Washington for the use of the federal marketplace, we continue to see policies enacted that threaten the progress made by the Affordable Care Act and made our work more challenging. From 2017 to 2018, enrollment in the individual market dropped for the first time since 2014 and continued to drop the following year. When New Jersey took control of outreach and enrollment assistance in 2020 as a state-based exchange on the federal platform, we began to reverse that trend. Get Covered New Jersey will open for enrollment on November 1st and will keep more than $50 million in our state to strengthen the marketplace. Residents will see benefits that include new state subsidies on top of premium tax credits. The estimated average subsidy for an individual would be at least $578 a year and at least $2,313 a year for a family of four. The average net monthly premium for those eligible for financial help is estimated at $117 a month for 2021, compared to $164 a month in 2020. Increased navigators to provide free enrollment assistance with $3.5 million in funding 16 navigators, up from one navigator under the federal government in 2019. 3 months to enroll compared to its 6-week window under the federal government. And residents will also benefit from our ability to respond to the needs of the state with a special enrollment period, such as for COVID-19 and qualifying life events, including pregnancy, which improves maternal health, which has been a focus of this committee, as well as a focus of the First Lady of New Jersey. We have taken deliberate progressive steps to stabilize our market and improve access to coverage, all leading to the establishment of our marketplace for this open enrollment period beginning November 1st. With the public health emergency we are facing, we believe there is no better time than now to make this transition. Chairman, thank you for the opportunity to speak before you and your panel.
Commissioner Caride, I am very honored to see you again. You happen to live in my district, right?
That's correct.
How to get that commercial in. Our next witness is Kevin Patterson. Mr. Patterson has served as the Chief Executive Officer of Connect for Health Colorado since April of 2015. And of course, he was an interim Chief of Staff to Governor Hickenlooper. Mr. Patterson, please.
Thank you, Mr. Chairman, Chairman Pascrell, Ranking Member Kelly, and subcommittee members. Thank you for the opportunity to submit testimony on behalf of the Insurance Exchange in Colorado and the people who rely on getting their coverage through the individual market here. Again, my name is Kevin Patterson. I'm the CEO for Connect for Health Colorado. Our mission is to increase access, affordability, and choice for individuals, families, and small employers purchasing health insurance. I'm proud of the innovation and collaboration in our state to steadily reduce the uninsured rate and increase enrollments. I'm pleased to share more with you today about our achievements as a state-based marketplace and how this unique position allows us to expand healthcare coverage to the people of Colorado. Since we opened for business in 2013, we have helped hundreds of thousands of Coloradans get the coverage they need to protect their health and livelihood. However, Colorado's path to increasing access to affordable health care and choice started years before the passage of the Affordable Care Act. In 2006, a bipartisan group of state lawmakers created a commission to study models for comprehensive reform under then Republican Governor Bill Owens. With the passage of the ACA in March of 2010, our state legislature passed a bill creating the Colorado Health Benefit Exchange as a public nonprofit entity that has a bipartisan legislative oversight committee. Board members are appointed by the governor and both Democratic and Republican members of the legislature. I joined Connect for Health Colorado as CEO in April of 2015 when the state's uninsured rate reached a record 6.7%, one of the lowest in the country. Charged with further increasing access, affordability, and choice for our residents, I knew we had to prioritize meeting people where they are. So whether I'm having a conversation with a single mom in Denver or a farmer on the Eastern Plains, I and the rest of my marketplace team are listening and learning from Coloradans about viable solutions for accessing healthcare in their community. Generally, every fall, I visit many rural communities around the state to hear from them and share the upcoming open enrollment period. This year, these challenges of face-to-face visits are leading me to have these conversations virtually. I'm thankful for the opportunity to still see our partners, community leaders, and local policymakers outside of Denver. Since our inception, we have funded our Navigator program, or what we call our assistance network, at approximately $2 million a year in about 45 sites. They are integral to our success enrolling customers and providing health insurance literacy. Our assistance sites have also built relationships with small businesses, regional hospitals, and surrounding communities. Their work is vital to our ability to reach especially vulnerable populations, including families with low income, disabled population, immigrants, and folks in rural corners of the state. The ongoing public health emergency has also underscored the value of our relationships with local counties and flexibility we wield as a state-based marketplace. In mid-March, we made the decision to open a special emergency enrollment period in response to COVID-19. In early April, the Adams County Commissioners informed me that their constituents were still experiencing hardships as a result of efforts to combat the coronavirus. We listened and we decided to extend our emergency special enrollment period through the end of the month. Our assistance network and brokers were ready to field questions from those unexpectedly without coverage and help them enroll. As a result, over 14,000 individuals enrolled in coverage during this emergency special enrollment period. We continually explore ways to expand coverage with policymakers and advocates. We will be integral in the implementation of 2 new programs that passed the Colorado legislature this year: the Health Insurance Coverage Easy Enrollment Program and the Health Insurance Affordability Enterprise. I'm excited that we can extend access to affordable health coverage for Coloradans with a simple act of checking a box. I'm also looking forward to greater stability and cost due to the reinsurance program, especially for consumers who do not qualify for financial help and are still struggling to access coverage. With job loss and income instability at an all-time high in our state, it is more important than ever that we remove barriers to healthcare by providing portable and affordable healthcare options like those offered through our marketplace. Amidst the challenges we face every year as a state-based marketplace, I'm encouraged by the fact that we have flexibility, crucial relationships, and proven capability to ensure our residents have and access the coverage that they need. Thank you.
Well, thank you very much, Mr. Patterson, for summarizing your remarks. I deeply appreciate that. Our third witness is Andy Slavitt. Mr. Slavitt currently serves as the board chair for the United States of Care. Previously, he was the former acting administrator for the CMS. Mr. Slavitt.
Chairman Pascrell, Ranking Member Kelly, members of the committee. I'm Andy Slavitt, the former head of the Centers for Medicare and Medicaid Services and board chair of United States of Care. Founded in 2018, US of Care represents a movement of nonpartisan citizens, former policymakers, and experts who are committed to working so that every single American has quality, affordable health care regardless of health status, social need, or income. Before I continue, I want to please recognize the late Chairman Lewis for the great service to this nation. Thank you for inviting me to testify on the status of the Affordable Care Act. We sit at a perilous moment in our nation's history and for millions of American families. The global coronavirus pandemic has taken hundreds of thousands of American families in a matter of mere months. As many as 14.6 million people have lost their health insurance coverage, along with their jobs, at a time when the health of each American is more connected than ever before. Unfortunately, COVID-19 is not the only threat Americans are facing right now. Rather than support Americans through these trying times, the Trump administration has added to the uncertainty facing Americans by attacking the very existence of the Affordable Care Act. The ACA serves two main functions: patient protections and affordable care. The law provides every single American a guaranteed set of protections, including prohibiting insurance companies from discriminating against them on the basis of a pre-existing condition, and outlaws insurance companies from stopping coverage due to arbitrary annual or lifetime limits. The ACA has provided coverage to tens of millions of Americans through expanded Medicaid and the ACA exchanges. This quite simply has been life-changing. The ACA is saving Americans $4,000 per family, and many now can afford their prescriptions and to see their doctor for the first time. And the ACA saves 12 million seniors an average of $2,200 on their prescription medication and eliminates the age tax that made insurance unaffordable to Americans 50 and older. Rather than implement the law as Congress intended, over the last 4 years, this administration has undermined the law with a clinical callousness. These actions have included cutting funding for Navigator to assist people enrolling in coverage, as well as other outreach and advertising by 90%, shortening the open enrollment period, illegally attempting to end payments owed to insurers to discourage them from participating in exchanges, promoting insurance plans which have substandard or limited benefits, which raises the price of insurance and brings back the fine print gotcha policies that kept so many people from getting the health insurance coverage they thought they purchased. When I served in the Obama administration, I had responsibility for administering the laws passed by both Democratic and Republican-controlled Congresses. I understood that I had a duty to implement the laws passed on by Congress to the best of my ability, that the executive branch did not get to choose which laws we liked and which we didn't. But not so with this Trump administration. They have taken this to a new level now by refusing to defend the people in a case brought by Republican attorneys general to invalidate the Affordable Care Act and take their health insurance. The public now faces great uncertainty as to the future of this law, just as a deadly and serious virus is making its way almost completely unchecked through the country. The effect of the lawsuit, were it to be successful, would put 130 million Americans in a situation where they could be uninsurable for prior illness. And with the COVID-19, this is even more troubling. It is the ultimate pre-existing condition. The virus attacks multiple organ systems, our clotting system, our immune systems, rendering our entire body a pre-existing condition. In 12 days, the 8th open enrollment period for the ACA exchanges will commence. Despite the efforts of repeal, despite the refusal of Congress to build on the law, despite continued negligence and sabotage, millions of Americans will get health insurance coverage for their families. And Americans do not understand why protecting their families is controversial and has been opposed at every turn by this administration. Americans would like nothing more than for the bipartisan fighting over their health to stop. At times like these, people expect the support of their government, not making their lives more challenging. All people ask is to be able to care for their families, keep them healthy, and not fear bankruptcy at the first sign of illness. They certainly would like to stop fearing the very government they elect. In this country, that should not be too much to ask.
Thank you, Mr. Slavitt. We appreciate your presentation today. Now I'm going to call on our last witness, Mr. Pope. And Mr. Pope, you have 5 minutes. Try to summarize, and we're honored to have you here.
Thank you, sir. Chairman Pascal, Ranking Member Kelly, thank you for the opportunity to appear before the Ways and Means Oversight Subcommittee hearing on expanding health insurance coverage to more Americans. As the American people prepare to head to the polls, the committee is doing them an important service by taking time to review the arguments made over the past 4 years the claims made against them, and the evidence regarding how they've worked out. Now, it's clear that the Affordable Care Act subsidies expand as necessary to guarantee coverage to individuals with pre-existing conditions. But the Affordable Care Act wasn't just subsidies to protect people with pre-existing conditions, but also a dysfunctional change in insurance market rules. The Affordable Care Act required insurance to be priced the same for people who waited until they got sick before purchasing insurance as it was for people who signed up before they got sick. This had the obvious consequence that premiums spiraled up, deductibles soared, insurers panicked, tried to restrict their networks. Many dropped out of the insurance industry, or at least the individual market altogether. And we've been left with a situation when 4 years ago, the average premium plus deductibles, the amount of money that a family would pay to get coverage would be $22,000 before they had any medical care paid for. That's not an attractive insurance market. It's not something that's going to be appealing. It's least of all a success. It was an urgent necessity to establish an alternative source of coverage and a source of appropriately priced insurance, which give people value if they signed up before they get sick, something that's priced in proportion to their risk and in proportion to their needs, and to basically rewards them for signing up prudently in a timely manner. The short-term limited duration market was not perfect, but it was the best opportunity to do this. And for this, individuals who enroll in the STLDI market are able to get better benefits at the same price, for the same price that they would at the Affordable Care Act, and a much cheaper price for the cheapest available plans. At the same price for equivalent ACA plans, they will find better networks, and these plans have higher satisfaction ratings. So the administration was right to try and make STLDI plans more available. Congress is also right in repealing the mandate, or at least zeroing it out. The mandate had proven ineffective, and because so many exemptions have been created under the Obama administration, what remained of it was really just an unfair and inequitable tax. A lot of claims were made that the sky was going to fall if the mandate was zeroed out and if STLDI plans were allowed to be made available to Americans. None of these predictions came true at all. We were told the premiums would soar. In fact, they soared before the mandate was repealed, and since the mandate has been eliminated, premiums have been stable, in fact, slightly reducing. Enrollment itself has also been stable in the ACA market since the mandate has been zeroed out. So has been the effect with the STLDI deregulation. STLDI deregulation, if you look at the states where plans have been made available, premiums on the ACA market haven't soared or increased, and enrollment hasn't plummeted in STLDI states any more than it has in non-STLDI states. There has been no discernible harm whatsoever to the ACA market from the provision of STLDI plans. All that has happened is that millions of Americans have been able to buy affordable insurance, the majority of which would have otherwise been uninsured. There are flaws with STLDI plans. This was nobody's idea of a perfect insurance market. It was the best that could be done in a regulatory framework that had been established by the Affordable Care Act. Restricting plan term lengths to 3 months, as had been done under the Obama administration, creates a huge incentive for short-termism and for plans to restrict long-term coverage of chronic conditions. These are real problems. They are best solved by guaranteeing renewability for plans over the long run, eliminating restrictions on guaranteed renewability of short-term plans so that if an individual develops a major chronic condition while enrolled in the short-term plan, the insurer has to cover it this year, next year, and into the future. Under proposals to restrict short-term plan renewability, as prevailed under the Obama administration, if an individual enrolled in an STLDI plan got cancer, the insurer would actually be forced to drop them from coverage and would be banned essentially from covering them again. That's exactly the wrong way to proceed. We should protect consumers, not eliminate options from them.
Mr. Pope, thank you so much for your presentation. We appreciate it. And at this time, I will open the hearing for questions. Without objection, each member will be recognized for 5 minutes to question our witnesses. If the witnesses will respond with short and concise answers, all members should be able to ask questions. As mentioned earlier, we will not observe the Gibbons rule in this remote setting. We'll instead go to the order of seniority for questioning, alternating between minority and majority, beginning with members of the Oversight Committee. Members are reminded to unmute yourselves when you are recognized for your 5 minutes. I'll begin by recognizing myself. And Mr. Pope, let me just have a quick question before I start my questions, which I had prepared. Do you advocate that we eliminate or that the courts eliminate the ACA?
No.
Is that what you're advocating?
That's not what I'm advocating, no.
You're not advocating that. That's interesting. Thank you. I have a question. The question is for the entire panel. Please answer with a simple yes or no. The nation continues to battle the coronavirus pandemic with over 8 million cases and more than 220,000 deaths. Too many families are struggling to make ends meet. Do you agree that access to health insurance is more important than ever amidst the ongoing coronavirus pandemic? And I will start with the commissioner. Yes or no, Mr. Patterson?
For Mr. Patterson in Colorado, the answer is yes.
Ask now, Karibe?
Yes, Chairman. The answer for New Jersey is yes.
Mr. Slavitt?
Yes, Mr. Chairman.
Mr. Pope?
Yes, Mr. Chairman.
Thank you. Commissioner, why did New Jersey decide to establish a state-based marketplace rather than relying on the federally facilitated marketplace?
Thank you, Chairman, for that question. As I mentioned previously, we were sending funds to Washington, and the money that we were sending, we weren't being able to utilize it properly. And on top of that, we were seeing policies that were coming out of Washington that was just creating confusion and making our job much more challenging. By keeping those funds in New Jersey, we're able to tailor it specifically to our residents. We've been able to use that money to improve and expand our navigators program, outreach, education.
Just explain the navigators quickly, very briefly.
Yes, Chairman. The navigators are individuals, organizations in the communities that help our residents to enroll them on the exchange, to educate them about the exchange, to explain the exchange. We had one navigator in 2019 while under the government, under the federal platform, and we have managed to invest much more money now, $3.5 million, and expanded to 16 navigators for this coming open enrollment.
Thank you very much. Mr. Slavitt, how destructive would it be for the Supreme Court to overturn the Affordable Care Act during a pandemic?
Mr. Chairman, there's never a good time to take people's healthcare coverage away from them. But at a time when they are getting a mysterious illness that we don't even understand, when many, indeed, children and college students are getting an illness that appears to be asymptomatic, decades from now, they could develop things as like heart arrhythmia or asthma. Insurance companies will be able to deny coverage on the basis of pre-existing conditions if the Affordable Care Act is eliminated. A vast majority of Americans do not want to see the ACA eliminated, and I think it would be a significant mistake. But it might also add that in the pandemic, it's important that people are able to report their illnesses so that we can contact trace and prohibit the spread. Once people start to worry about insurance coverage again, they will not disclose their illnesses, and the virus will spread even more rapidly.
Is this Mr. Slavitt, is this an exaggeration on my part that during the pandemic, millions of people lost their jobs, and many of them lost their insurance. Is that an exaggeration? Is that hyperbole?
No, in fact, press reports and data analysis suggests you're exactly right, Mr. Chairman.
Well, what's going to happen to these folks if the Supreme Court says that's enough, no more of this?
I think Americans will go into bankruptcy. They'll avoid getting medical care. We'll be back to where we were in the early 2000s, but worse, with a disease spreading around the country nearly unchecked.
And finally, have you seen the Republican plan to replace the ACA?
I have not.
Thank you, Mr. Slavitt. I appreciate that. I want to recognize my friend, Mr. Kelly, for 5 minutes to ask his questions.
Thanks, Chairman. I appreciate it. First of all, I'm a small employer myself, and we do provide insurance for the people that are on our team. And I would just suggest that most small employers really look at their workforce as family, not as some unimaginable group of people. They are the people we work at their day with for mutual success. I just want to go over one thing now. In Mr. Slavitt's written testimony, he says that there's 14.6 million Americans that, and here's the key, may have lost employer-sponsored insurance since the pandemic began. But according to the CPO, about 3.9 million people are dealing with permanent job loss and had an offer of employment-based insurance. So of those 3.9 million Americans that may have permanently lost their job, I'm saying may have, 1.3 million are estimated to be uninsured. So a third of those are estimated to be uninsured, while others have obtained new coverage. So, I mean, listen, there's no question this pandemic's been a strain on all of us. But I want to address one of the myths that the administration is trying to sabotage the ACA. The Trump administration and House Republicans have committed to providing the health insurance options that Americans want and need. Now, any indication that this administration is sabotaging the Affordable Care Act is simply not supported by the facts. Healthcare premiums are down, right? Choices are up. Competition between insurers is up. And Republicans have confirmed time and time again our support for protections for those with pre-existing conditions. So I wish we'd quit saying that's not the Republican plan. It absolutely is. Now, despite that, there's still a lot of issues plaguing our system and making it unaffordable for many. So, Mr. Pope, as an expert, do you think this is an issue that should be solved by Washington? And if not, what can our Congress be doing today to bring down the rising costs throughout the entire healthcare sector?
Well, that's a great question. The big problem with the Affordable Care Act is it essentially said you can have any health plan you want so long as it's Obamacare. And that's not real choice. There has to be a broader array of choices, and it can't just be that there are plans that are out there that are priced the same if you sign up after you get sick as before you get sick. People need to be able to have a reward for signing up early, get a good value plan that is priced appropriately for someone who's doing the prudent thing. And if we make available options to individuals who are prudently signing up early for coverage, then as they develop a condition, it won't even have become a pre-existing condition because they will always have had insurance coverage.
Well, thanks. You know what? One of the things I want to point out that as part of the Health Association Plan Act of 2019, both House Republicans and Senate Republicans were talking about allowing people to actually become part of association health plans. That means they could spread the risk of the health insurance loss across a larger number of people and access the same lower cost and high quality health coverage as large employers have and unions have. Now, Democrats in several states have actually sued to block this rule change. So, Mr. Pope, can you tell us about why association health plans are a potential benefit to small businesses and sole proprietors and the self-employed? It's a huge issue.
Yeah, so if you look at where has traditionally been the strongest health insurance coverage in America, it's traditionally been large employers. And that's in large part because large employers are exempt from a lot of state regulation under ERISA. So association health plans allow smaller employers to bundle together and basically set up associations, as the name would suggest, basically benefits from some of the same regulatory freedom and flexibility in pooling health insurance costs that large employers have always been able to benefit from. So it really levels the playing field, allows small employers to do what big businesses have always been able to do.
Yeah, I appreciate that. Again, as a small employer myself, there's nothing more valuable to us than the people that come to work every day that we can have mutual success. So I thank you for being here, and all the panelists, thank you for being here today. One thing I want to point out, the Supreme Court future action, it really is about the constitutionality of the Affordable Care Act. Let's make sure that we actually put that in the right light. So, Mr. Chairman, thank you for the opportunity to have an exchange with our panel, and I yield back.
Thank you, Mr. Kelly. And now the chair recognizes Ms. Delbene for 5 minutes.
Thank you, Mr. Chairman. Thanks for convening this very important hearing, and I want to thank all of our witnesses for joining us today. During a global pandemic of such devastation, it's critical that we turn our attention to maximizing healthcare coverage throughout the country through opportunities that were created by the Affordable Care Act. Mr. Patterson, like Colorado, the Washington State Health Exchange has been quite successful. In fact, earlier this month, Washington Health Plan Finder announced that the proposed rates for next year are expected, on average, a decrease of 2.3%. If everything goes as expected, this would be the second year in a row that rates have gone down. Washington State took several steps to counteract the administration's efforts to destabilize the ACA individual marketplace. The best way to lower insurance premiums is to bring in more folks and expand the risk. Unfortunately, in 2018, the administration slashed funding for ACA navigators and marketing. Less marketing means fewer people signing up for coverage, a smaller risk pool, and higher premiums. But Washington State chose to fund marketing and sign-up assistance. Mr. Patterson, did Colorado take similar steps, and were you successful?
Thank you, Congresswoman. We work very closely with our partners in the Evergreen State. So I think Pam does a great job with her folks. And we've had an exchange of ideas. We do a lot in Colorado very similarly. We have a very diverse state, an urban corridor, Eastern Plains, and a lot on the Western Slope. So we actually just go out and meet with people, and we try to make sure that we have navigators literally in every corner. And so our assistance site, we've been funding it at about $2 million, as I said, per year. First, it was a grant. We've committed those funds out of our own revenue. So that's been really important to make sure that we are able to work with communities that are being missed or that have language barriers. And so we have a lot of support from brokers and assisters in different languages, in not just along the Front Range where a lot of the population is, but in all corners of the state. So I hope that answers your question, Congresswoman.
Thank you. In 2018, the administration allowed short-term limited duration plans to be extended for up to 3 years. These plans are intended to serve as a bridge between coverage because they don't have the protections that qualified ACA plans have. They don't cover all essential health benefits like maternity, mental health, or prescription drugs. They don't have out-of-pocket limits. They don't have to cover pre-existing conditions. So allowing customers to sign up for these plans for extended periods of time fractures the individual market and drives up prices in the ACA marketplaces. In Washington, we're fortunate that our insurance commissioner limited short-term plans to only 3 months, preserving a robust individual market. Again, Mr. Patterson, has Colorado been able to halt short-term limited duration plans?
Thank you, Congresswoman. In January, I believe, of 2019, our Division of Insurance and our insurance commissioner, Michael Conway, did put some different restrictions and regulations that they've updated around short-term limited duration plans. A lot of them around making sure they had an essential health benefit, as Colorado law covers, preventative services, prescription drugs, hospitalization, maternity and newborn care. So all of those pieces were in there. They also looked at some of the age ratings, a lot of the components that I think the commissioner would probably be a lot better in answering your question. But I do know that has been an effort that we have seen in Colorado and partnered with our Division of Insurance to help implement.
And then lastly, just collectively, how the actions that you've taken impacted premiums and ultimately enrollment in the ACA marketplace in Colorado?
Thank you, Congresswoman. So we have, like I said, we've done a lot around reinsurance. And last year we saw about a 20% reduction in rates. We're also looking at large reductions in some of the more high cost areas in that same vicinity, but an overall rate reduction in Colorado of about 1.46%, if my memory serves me correctly. And we've actually added carriers. And so we've gone from, we've got now, we used to have 7 carriers last year. We've got 8 going into this open enrollment and about 160, almost 160 standard plan for people to choose from. So we've been able, I think, with a lot of our outreach, a lot of the work that we've been doing on the ground, talking and listening, more importantly, listening to our citizens in every corner, as I say, about what they're needing and trying to facilitate the right kind of approach that has given us the success we're proud of.
Thank you so much. Thank you, Mr. Chairman. I yield back.
Thank you. I forgot to mention this before. Based on the members in attendance and consistent with the committee practice, we will move to 2-to-1 questioning after Representative Walorski. Now I'd like to please call on my friend from Indiana, Ms. Walorski. Thank you for being here.
Thank you, Mr. Chairman. Thanks so much, and thanks to our panel. Appreciate you being here today as well. Well, here we go again. Instead of having a hearing on how we can work together and find bipartisan solutions in healthcare, we're back to the only thing that we've seen so far, which is political messaging. And we all know that Americans have been faced with rising costs, fewer options, and a chaotic healthcare system. Fortunately, under this administration, we have made progress in these areas, but these are still ongoing issues that need to be improved in my district. So that's what I think we should be focused on. The only thing we get from the other side is finger pointing and accusations that Republicans and the administrations have undermined the ACA. I think if we put politics aside, work on this in a bipartisan way, I think if we had all the rank and file members together, I have no doubt we could build some kind of a better patient-centered system that would lower costs, maintain protections for patients with pre-existing and no lifetime caps, give states more flexibility, give families and individuals more choices and greater control over their own health care. This committee was able to pass a bill to end surprise medical billing so Americans wouldn't have to worry about unexpected healthcare bills. Even though the bill hasn't become law, at least we were able to come together in an agreement on fixing the problem. I still think we can work together. We could expand access to coverage and while lowering costs, increasing choice, giving individuals more control and maintaining important patient protections. Mr. Pope, we've watched the majority try everything they could to entice people into ACA plans, going so far as to outlaw other insurance plans. Speaker Pelosi's latest COVID package attempted to throw more money at the ACA's problems, even allowing millionaires to receive thousands of dollars in subsidies. Can you walk us through some of the reasons why in 2019, 2/3 of ACA eligible Americans opted for a different option?
Well, that's a very good way of putting the context of this. I think the Affordable Care Act's problems in terms of the individual market come down to one thing. It's pretty simple. It's the price. These plans, they're far too expensive for what they are. The benefit, the deductibles are very high, but if the premium was low, the deductibles would be okay. The networks aren't very good, but if the premiums were low, the networks would be okay. The covered benefits are fine. The premiums are far too high relative to what people are getting, especially if they sign up before they get sick. So if you're a cancer patient, as a safety net, if you're someone who never bought insurance before and all of a sudden you need a safety net source of care, the Obamacare plans are fine as a safety net as a last resort. But as a good quality source of insurance coverage that gives people a reason to sign up while they're reasonably healthy before they have a major medical condition, it's just not good enough.
Let me ask you this. How would you characterize the current state of our healthcare system across these 3 areas? First, what happened to premium costs in the 4 years following the establishment of the ACA's reg reforms and in the 2 years since the individual mandate was repealed and short-term limited duration plans were expanded? And then second, on the number of options available to the public, and then third, on the number of enrollees in the ACA.
Right. So the premiums increased by 105% from 2013 to 2017 as the ACA's insurance regulations were changed. That's more than doubling, really. And we've seen that a lot was said that this was going to be outweighed by the impact of rolling back short-term insurance, repealing the mandate, eliminating the mandate. But those two policies that have recently happened have had essentially no impact on premiums. Premiums have actually leveled off, in fact, slightly fallen. We've seen again yesterday, news came out that they slightly declined. Enrollment is as stable as it has been in years. And in terms of options, we're starting to see insurers that have fled the marketplace because it was in chaos, starting to come back in. Some of the major insurers starting to realize there's now some stability. They know what they're dealing with. And it's not great insurance coverage that someone would buy before they get sick, but as a safety net, it's workable.
Thank you, Mr. Chairman. I yield back.
Thank you very much, our friend from Indiana. Next, I'd like to call on the gentle lady from California, Ms. Sanchez.
Thank you, Mr. Chairman, and thank you for holding today's important hearing. I also want to thank each of the witnesses for taking the time to be here. For the last decade, we've been so busy working to protect patients. We know more work needs to be done, and this pandemic has magnified for us that we must do more to eliminate the systemic health disparities affecting our communities. That's why I'm so tired of the president and his administration's blatant attacks to make healthcare harder to access. They are making people fear for their healthcare during a pandemic where over 8 million Americans have contracted the virus and 220,000 have lost their lives. It's an absolute disgrace. An executive order saying that you protect patients with pre-existing conditions does not negate the fact that the administration is in court right now trying to overturn the ACA. Overturning the ACA means removing the protections for over 300,000 people under 65 with pre-existing conditions in the district that I represent. The protections help our neighbors with cancer, diabetes, asthma, mental illness, and many other conditions. Apart from pre-existing conditions, I want to talk about another provision of the ACA. In 2009, I was one of the authors of the provision that stopped health insurance companies from engaging in gender rating. Simply put, the ACA does not allow a woman to be charged more than a man for the same health care plan simply because of her gender. Mr. Slavitt, I want to start my questions with you. Do you imagine that this gender rating provision would be protected if the ACA was overturned in court? And what would that mean for women in this country?
Thank you, Congresswoman. No, and in fact, one way to tell that is these short-term limited duration plans and these association health plans that we've talked about are able to charge women more for their coverage, and also to deny them essential things that are important to everyone's health insurance coverage. Even provisions that affect both genders, like mental health, excluding those from coverage, as these policies often do, is an incredible disservice. Americans don't know when they're going to need a particular service, so discriminating against them and leaving out things that they expect to find in their policies do them an important disservice.
So would it be fair to say that women would probably pay more for their health insurance if the ACA were taken away, and that they probably wouldn't get the services that they need?
They did before the ACA, and they would after.
Thank you. I also want to discuss specifically how communities of color are impacted by the ACA. Mr. Slavitt, could you talk a little bit more about why the ACA is important in reducing health inequities, and how has the administration's constant attacks on healthcare navigators and advertising for the marketplace impacted communities of color?
Well, there's terrific news from the ACA. The first 5 years of the ACA saw reductions in disparities in cancer care, in cardiology, in maternity, in infant health, and in things like home ownership, and in things like reduction of bad debt. So that's been great news. Unfortunately, without the outreach that the ACA and that Congress and its wisdom included in the package, there's no ability to reach communities that are on the margins and help them enroll for coverage, whether it's a language issue or a cultural issue. And that's why we've seen reductions in coverage. That's why we've seen increases in the uninsured rate since the Trump administration has begun overseeing the Affordable Care Act.
So would it be fair to say that they've been trying to undermine or sabotage the coverage that the ACA could provide?
Well, they have in fact undermined and sabotaged the Affordable Care Act.
Thank you for being so forthright on that. Commissioner Carriday and Mr. Patterson, I'm also interested in briefly learning about how your states are helping communities of color and why the administration's sabotage and confusing messaging is so detrimental. And you'll need to be brief because we've got about a minute left.
Thank you, Congresswoman. In New Jersey, we went from one navigator in 2019 while we were under the federal platform. Since taking back control, we have now increased it to 16 navigators that will be able to blanket our state, reaching communities that are uninsured. As a Latina, it kills me to see that my community is double in percentage of uninsured when compared to the rest of the uninsured market here in New Jersey. And if you look at the Latino community throughout the country, it's one of the highest uninsured rate, the population with the highest uninsured rate. So we have invested in our community as well as in our navigators to make sure that we are able to reach all of the underrepresented communities here in the state of New Jersey.
Thank you. I believe my time is up, but before I yield back to the chairman, I would ask that Mr. Patterson be allowed to respond in writing at a later time.
Thank you very much, the gentlelady from California. Now the gentlelady from California, Ms. Chow. Ms. Chu.
Thank you, Mr. Chair. Thank you, Mr. Chair. First, let me say to those on the other side of the aisle who use the term China virus in this hearing, the scientific term is novel coronavirus or COVID-19. By not using the scientific term as established by the World Health Organization, you are stoking the flames of xenophobia, which has resulted in 2,900 anti-Asian hate crimes and incidents. Well, pivoting to Mr. Slavitt, thank you for joining us today. I'd like to focus on what is at stake for 135 million Americans with pre-existing conditions should the ACA be struck down. When we wrote the Affordable Care Act, Democrats created a multi-pronged approach to protect those with pre-existing conditions. Under the ACA, you cannot be denied coverage for having a pre-existing condition, but you also can't be charged more for it, and you can't be subject to a lifetime cap, and you're required to offer minimum essential health benefits like hospital stays and prescription drugs. Although the president and Republican proposals have paid lip service to protecting Americans with pre-existing conditions, their proposals all fall short of actually doing so. Last month, President Trump issued an executive order that he claimed would protect those with pre-existing conditions. Mr. Slavitt, would you say Mr. Trump's executive order protects those vulnerable Americans? And if not, why not? And why have Republican proposals to replace the ACA fallen short of its protections for Americans with pre-existing conditions?
My parents taught me to watch what people do, not what people say. And unfortunately, what the continued actions of the Trump administration to eliminate the ACA, to sue, to get rid of it, to propose laws that do not cover pre-existing conditions like short-term duration plans, all of which show me what they want to do, not just what he says. Unfortunately, if any American was to print out an executive order from the President of the United States saying that they would have their pre-existing condition covered and brought it to an insurance company, the insurance company would laugh at them because an executive order like that does not have the power of law. And so I would urge Americans to look at his actions, not at his statements.
Thank you. Mr. Patterson, I wanted to ask you about the wonderful work Colorado's done to expand its family planning program. Thanks to a massive investment from a private grant and the implementation of the ACA, Colorado was able to expand access to contraceptives for young people, including the long-lasting IUD. Thanks to this investment, the teen birth rate for girls ages 15 to 19 dropped by more than half, falling 59% from 2009 to 2017. And similarly, the abortion rate amongst Colorado teens fell by 60% during those years. These are remarkable statistics. However, if the Affordable Care Act were to be struck down, patients would once again be required to pay for the cost for their contraceptive and family planning care. And that could be thousands of dollars. For young people, the cost can be the barriers to accessing the health care that they need. So, Mr. Patterson, how would losing the preventive services benefit of the ACA impact family planning in Colorado? Would losing this benefit increase costs for patients in the state?
Thank you, Congresswoman. Yes, you're going back to my time with the governor's office, but I think that was one of the things we were proud of back then is the long-acting contraceptives. And so I think that we've seen, like you showed, great strides in reducing those. And I think those costs and those outcomes would be the opposite if those resources weren't there.
Thank you. Mr. Slavitt, I'm so proud that my state of California is one of 5 states that has prohibited the sale of short-term limited duration plans or junk plans on the marketplace. So, Mr. Slavitt, can you expand on how these junk plans will undermine the ACA marketplace and put patients at risk? Are these junk plans a sufficient replacement for the ACA?
Yeah, I think it's important, and it's an important point that Mr. Pope brought up earlier, which is to say, what kind of choice should Americans have and do Americans want? I think everybody believes that there should be some amount of choice, but there should be certain guardrails that exist. The ACA builds in those guardrails to suggest that there are 10 essential benefits that Americans really are in no position to say, I don't want to have hospital coverage. I don't want to have my prescription drug coverage. Those are good ideas until that occurs. Those are not expensive provisions, by the way. Mental health coverage is about 1% to 2% of overall premiums. So people think they're getting a good deal if they save premiums, but it's as if we got a fire insurance policy and we come to read the fine print to find that it doesn't cover the kitchen. It only covers the living room. So there's certain basics that I think Americans want and should agree to. And for a 3-month period, in transitional period, it's probably acceptable for people to be in that kind of circumstance. But to buy insurance coverage for their family and to find out that they can't use it, which is what happened routinely prior to the ACA, would be an enormous issue.
Thank you, Mr. Sally. And I want to thank the gentlelady. And I want to say that using that term China virus, Congresswoman Cho, is unacceptable in this committee, period. I'm now going to call on Mr. Wenstrup from Ohio. Doctor?
Well, thank you, Mr. Chairman, and thank you all for being here today and contributing to this conversation. I just want to start out by echoing what my Republican colleagues have said about pre-existing condition. The pre-existing condition component of the ACA was not something that we were against. We stand with patients with pre-existing conditions and will continue to ensure that those protections become the law of the land and remain the law of the land. But there's a difference between challenging the existence of the ACA versus the constitutionality of a component of it. And I would never want to take the right of any American away to challenge the constitutionality of a bill that we pass. Bigger than that, Republicans want to put patients back in the driver's seat, especially when it comes to their health care. You know, the word sabotage keeps being used, and I'm sorry, but I can't help but think of a line from The Princess Bride where he says, you keep using that word. I do not think it means what you think it means. Because while the Affordable Care Act did help some, patients were sabotaged. And, you know, I'm reminded of what Mr. Gruber said when working with the Obama administration. He said about the Cadillac tax. He said they proposed it and that passed because the American people are too stupid to understand the difference. Maybe Mr. Slavitt worked with Mr. Gruber. And I think that that to me is sabotage. But the Affordable Care Act did not give people choices. And we have advanced policies to give patients healthcare options instead of leaving them with a one-size-fits-all approach. Families can now take advantage of health reimbursement arrangements, short-term limited duration plans, and hopefully in the future, better association plans. Another way we put patients back in the driver's seat is by advancing policies to increase healthcare price transparency. And I can tell you as a physician, that is a big deal. And that has to take place. At a time in our nation when Americans want to see their elected leaders coming together to restore our way of life, I'm disappointed we've gathered today for yet another partisan hearing, predicated on half-truths and manufactured fear. We do a lot of impactful bipartisan work on this committee. And our bipartisan rural and underserved healthcare task force, which I'm a co-chair of with Representatives Sewell and Davis, I think is a great example of how we can work together to advance our shared goal of improving the health outcomes of Americans. And I hope we can move past the fallacy that Republicans don't support pre-existing conditions, because we do, and work together in a bipartisan fashion to improve choice, access, and quality health care for the American people. There is no part about me as a doctor that doesn't want all Americans to have access to health care. It's too important. As the only one here who has served patients, I can tell you that the burdensome regulations the government has put in place over time has taken the joy out of taking care of people. And now Democrats want to go even further. 118 House Democrats have determined to end the current employment-based healthcare system as we know it by supporting Medicare for all. Another one-size-fits-all Washington-approved plan. It's dangerous. Republicans want to expand the plan options available to all Americans so they can decide what is best for their family. Mr. Pope, quickly, I know we don't have much time. Could you talk about the administration's rule change on short-term coverage and why allowing folks to choose the coverage that is right for them is important? And with that, if Obamacare's coverage is so great, then why is the market for lower cost alternatives growing so fast? Lifelines that Democrats want to eliminate. Mr. Pope.
The Affordable Care Act's plans were designed around the needs of people with pre-existing conditions, which is important. There needs to be a safety net for them. Not everybody has a pre-existing condition. Having an insurance plan that's tailor-made to someone who already has cancer is important, but it's not going to offer value for somebody who's trying to sign up and buy coverage a long time before they develop cancer or a major heart condition. And so you need to entice people to buy coverage with insurance that is priced in proportion to their risk. And that is what the short-term insurance option does. It basically creates an opportunity for people to buy insurance that's priced in proportion to their risk without really having any negative impact on the protections for people with pre-existing conditions that the exchange provides. It exists alongside it, it coexists, it provides a better alternative and a more appropriately priced alternative, which is really the core problem with the Affordable Care Act. It all comes down to price.
So you would say that it has helped many Americans?
Yeah, the data's sketchy. We don't know how many exactly, but millions, surely.
Thank you. I yield back.
I want to thank my friend from Ohio. Appreciate his questions. And Mr. Pope, we thank you also. Now I'd like to ask the gentlelady from Wisconsin, Ms. Moore. Thank you for being here today.
Well, thank you so much, Mr. Chairman. And I have really enjoyed this hearing and really appreciated the comments of all of them. And so it's so frustrating not to be able to ask questions of each of them. I guess I really want to, since we have had a lot of discussion on we're talking about the Affordable Care Act, I just want, I think Mr. Andrew, I can't see it right here, Mr. Slavitt, please. I just want you to clear some things up for me. Was the theory of the case around the Affordable Care Act that by requiring the individual mandate, we're going to draw in healthy people, like young people, and therefore reduce the cost of care for everyone such that it could be affordable to everyone? Wasn't that the theory of the case?
I believe that was Congress's intent at the time.
Okay, so wasn't the theory of the case also that really the government would provide things like the cost sharing reductions to make it more affordable, and also the risk corridors, so that as we provided enrollment to these younger people, that the amounts of monies that they lost, we would share in the coverage, the loss that these companies endured. Wasn't that also part of the theory of the case?
Yes, those were intended to keep.
Okay, and where I'm going with this is that when we talk about there being no intention of getting rid of coverage for pre-existing conditions, wasn't the theory of the case that we'd be able to support people like me who have cancer because we're getting premiums and getting the mix, and so therefore the math really doesn't work at all when you take out the mix of younger people. So notions that Mr. Pope has shared with us, that there aren't more uninsured people or we had, the court just 5 years later said that the United States has to pay those risk sharing costs because we had insurance companies all over the country just go out of business and leave people stranded as a result of that particular sabotage of Obamacare. Wouldn't you agree with that?
I would agree with that.
Right. So help me with the math while I still have time. Help me with the math of how insurance works. Tell me a little bit about these short-term limited duration insurance plans, and I'll give you an example. I have a nephew, 20 years old. He was 20 years old 10 years ago, playing basketball, having a good time, fainted, fell out. My sister-in-law, seeing something was wrong, rushed him off to the hospital. Long story made short, he was on a waiting list for 2 years for a new heart. Never smoked, anything like that. What would a short-term limited duration insurance plan for a 20-year-old like he was have done once that happened?
He would have no idea because the plan doesn't have to cover any. So there's no minimum coverage.
Right, and so it's he would have had an affordable plan. He would have had a choice of a plan, but once that basketball game was over, and what would have happened to him? And we've sabotaged the Affordable Care Act. The math does not work. I'm sorry about that. Without the protections for pre-existing conditions, you can make all kinds of speeches about it or resolutions to protect people. But if you don't have the incentive that we gave the insurance companies, that we have this broad base of people paying, then the math doesn't work. Do you agree with that, Mr. Slavitt?
Yes.
All right. And I have 49 seconds left. So I guess I'll give Mr. Pope an opportunity to respond. I just don't understand your assertion that the uninsured rate has gone down. According to all the data I've seen, that the uninsurance rate has gone up. I am very sympathetic with your notion that it costs too much, but you never mention stuff like the risk sharing, the other kinds of sabotage that this administration did, including not marketing it or anything. Would you stipulate that that also had something to do with the Affordable Care not being as good as it could have been?
So the Census Bureau found that the uninsured rate went down this year in one of its surveys. The key thing with the renewability
is it because they took these skinny plans?
Yeah, and I agree that there are flaws with them. I think the core problem is that their renewability has been limited and remains limited. So exactly your nephew's problem is exactly the problem that I think still needs to be fixed. Is the short-term plans can't be renewed for more than 3 years, and in some states not more than 6 months. And so that's why these people aren't able to have good protection from the short-term plans, because the insurers is just banned from renewing them and from continuing those protections over the long haul. That should be allowed. That I think is a fix that Congress should do.
My time has expired. Thank you.
I want to thank the gentlelady and for some excellent questions, and Mr. Pope for your response and all the witnesses so far. The chair now recognizes for 5 minutes the gentleman from Pennsylvania, Mr. Boyle.
Well, thank you, Mr. Chairman, for holding this important hearing. Healthcare would be an important topic at any time, but especially as we're now 8 months, though it seems like 8 years into this COVID crisis, and we are unfortunately the country that is leading the world in most COVID cases and most COVID deaths. That's not just because of our population, We are 4% of the world's population and yet still account for more than 20% of the COVID cases and tragically more than 20% of the COVID deaths. Speaking of COVID, I would like to thank all of the witnesses, but I want to especially thank Andy Slavitt. I personally follow your Twitter, and throughout this COVID crisis, I've found the information that you provide very helpful and a real service. So I want to thank you for that. I'll also direct my first question to you. As you know, and as has come up, exactly 1 week after Election Day, 3 weeks from now, the Supreme Court will hear oral arguments in yet another case about the constitutionality of the Affordable Care Act. Given that it was only found to be constitutional by a 5-4 vote in 2012, if the ACA were to be struck down by the Supreme Court, could you help me bring it home to my constituents in my home state of Pennsylvania? And are you able to direct what the consequences would be? I know they would be nationwide, but specifically for my state, what would be some of the consequences if the ACA were to disappear?
Thank you, Congressman, and I appreciate the question. And I know that the people of Pennsylvania and in your district, millions of whom in Pennsylvania, hundreds of thousands of whom in the Philadelphia area, received coverage for the first time. And I know what that means because while I was not part of the law, I was part of the turnaround process as the law was implemented. And I received and read many, many letters from constituents, including in your area. One I recall from a woman who said that when she got insurance, it was the first time after the Affordable Care Act that she allowed her daughter to play high school volleyball because before then, she was concerned that if she got injured, she would not be able to afford her medical care. I've received so many letters like that. And when you add them all up, you think about the law going away, it not only puts Americans who are already fearful of this global pandemic into a more fearful state, it puts them in a state where they're not sure they'll be able to pay for their health care if someone is to get sick. And if they do get sick, whether they'll ever be insurable again. So the court decision to strike down the Affordable Care Act would be calamitous at any time. It would be especially calamitous today in this environment. And I can't imagine how people would be able to recover from that. This is a time when we look to our government for help, and we hope that the government will help us, not undermine us.
Yeah, well, thank you for that. I would just further point out that specific to my state, it wouldn't just be the people on the exchanges that would lose out. It would also be all those who benefited from the Medicaid expansion, which happened several years later because of the ACA. And those are people in particular who are the working poor, people who are working full time, yet aren't covered by their employer for health insurance.
And seniors as well.
Yes.
With their prescription drug benefit, correct? Yes.
Right. I'm glad you pointed that out. I just in the minute I have left, moving ahead to Mr. Patterson, if optimistically from my view, the ACA is again found to be constitutional, we still have long-term the issue of ensuring that the exchanges are vibrant and that there's plenty of competition on them. I know especially early on when the exchanges were rolled out in some states, in some marketplaces, there was a challenge of a lack of competition. What are things that Congress could do at the federal level to ensure that we have as much competition on the exchanges as possible and as much choice for the consumer?
Thank you, Congressman. In terms of what Congress can do, I have to be careful on my answer, but I actually think just giving us the flexibility that we need. I think all states have a little bit different. You know, we're about 104,000 square miles in Colorado. It's a lot to try to figure out how do we help leverage the right networks and the right choices that people have. And I think just allowing states to have the right amount of flexibility to fit the needs, the geography, and the demographics of their own states is really, really important.
I think a gentleman's time is up. And I would now want to ask Mr. Smith of Nebraska, the gentleman, to start his 5-minute question. Thank you, Mr. Smith, for being here.
Thank you, Mr. Chairman. I appreciate the opportunity to have an exchange here. I do regret that, the entire healthcare issue has become so political. The mere title of this hearing is evidence of that. It's interesting to hear one of our witnesses say that he participated in the turnaround of the ACA or Obamacare. I don't want to take the time to get into the so-called turnaround. I wish that there were room on the panel to hear from some of my constituents who have faced such high premiums that some are opting not to buy it. And that contributes to some of the uninsured because it has become so expensive. Now, I don't see the solution as just throwing more money at it. That's not sustainable. I don't think we can carry that on for a long time. But I am just absolutely puzzled as to the numbers and the premiums. Now, before the ACA, we had the high-risk pools that I will tell you had some offensively high premiums. But now, when folks in the individual market face a similarly high premium that we used to find offensive, I don't hear the concern for those folks paying such high premiums now. And I realize that many of my colleagues here today, they think that the ACA is just fantastic and has been performing so well, but it hasn't. And I'm just going on what I hear from my own constituents. Now, there was some relief offered with some association health plans. Of course, the opponents to these consumer-driven choices have been sabotaging, by all means, sabotaging these consumer choices. And I think that's unfortunate because I think it's based on politics. I long for a day when we can have a thoughtful discussion about how we can get more people covered with affordable health insurance through affordable health care. Let's face it, the ACA was not healthcare reform. It just kind of shifted around who pays for what. And now the net result is more Americans paying more of their income for high premiums for health insurance. I just think we can do so much better. It's interesting. I just heard Mr. Patterson say we need more flexibility. I can't agree more. And he noted that he had to be careful with how he worded that. I can imagine, but clearly we need more flexibility. We need consumers to feel the empowerment to be able to decide for themselves what is best for their household, for them as individuals, in exercising the freedom to choose among plans, hopefully more plans rather than fewer plans. There were so many promises made about the ACA. I think about the health insurance co-ops and how much of a disaster that was, where we had a hearing after more than half of the co-ops had collapsed, and we had a hearing from the previous administration saying that everything's just fine. I don't know what metrics should be used in making that analysis, but man, we can do so much better. We as elected officials, I think, owe the American people a better discussion than what has been taking place. And I'm certainly willing to participate in that. Mr. Pope, can you tell me, with association health plans, we know there are antagonists out there who are opposed to consumers deciding for themselves to enroll in a plan of their choosing. Can you tell me what would be necessary to revive these association health plans that so many consumers found benefits in?
So the association health plans are for small businesses, really, that group together. So it is an employer-offered healthcare option. Traditionally, the large employers have been the ones that have been given a lot of flexibility in terms of what health insurance can be offered to their staff. And so the association health plan option expands that right to small employers that they can get together to offer, essentially exempt from a lot of state regulation, the same plans that large employers can.
Yeah, I'm
Mr. Smith, your time is up. Thank you very much. Thank you, Mr. Pope, for responding.
Thank you.
Now I want to call on the chair, recognizing the gentleman from Illinois, Representative Davis. Thank you for being here.
Thank you very much, Mr. Chairman, for holding this very informative hearing. And I also want to thank you for giving me the opportunity to wave onto it, although I am not a member of the committee. But I think that health policy and health care is so important that it touches everybody in our country. And so this has been a very delightful discussion. And I want to thank all of the witnesses for participating. Representative Boyle mentioned the fact earlier that the United States Supreme Court has health care on its agenda in a couple of weeks. And they're going to be discussing the same issues that we're talking about today. And I'm a big fan, I make no bones about it, of the Affordable Care Act. I think it's one of the best things that's happened to healthcare since the Indians discovered cornflakes. And that the Affordable Care Act itself is the best thing that we've had in modern years since Medicare and Medicaid, because it gave low-income people, poor people, an opportunity to have care paid for, which they previously did not have. I thank all of the witnesses, but Mr. Slavitt, let me commend you for your tenure when you ran CMS. It's a complex agency with complex issues and questions before it, and I think you did an outstanding job. So I commend you for that. While there are many components of the Affordable Care Act, and we've heard about it, and we've heard about them, but let me just ask specifically in terms of the disparities that we've learned about as we have discussed and dealt with COVID-19. African Americans have tremendous disparities in terms of health status, gaps in healthcare, followed by Latinx communities. If the Affordable Care Act did not continue or was dismantled, what would be the impact of that action on the health status and health care for African American and other minorities in this country?
Thank you, Congressman. I think anybody who is disadvantaged in this country, whether they're African American, whether they're Latinx, whether they live in a rural community where they don't have much access, whether they're poor and of any color, whether they're women or whether they're older, they were disadvantaged under the system we had before the Affordable Care Act. And indeed, disparities shrunk quite significantly over the 5-year period for African Americans. I'll give you one example. Cancer care disparities and outcomes were reduced after a 5-year period of the Affordable Care Act. So it would be a shame, given as I think as we know right now, the difficulty many African Americans and other minorities are having accessing the healthcare system during COVID-19, to take away that one lifeline that has been showing some improvement.
On the way that you have handled the situation, what has made it possible for the state of Colorado to enact the policies and implement them that you've discussed?
Thank you, Congressman. I don't think I heard the first part of your questions. I want to make sure I got that.
Oh, it just had to do what environment existed in Colorado that has enabled you to do what you've done.
Okay, my apologies, Congressman. I think we have a way that we reach out. We have a great network of brokers and assisters that I've spoken to. And I think just listening to folks and actually hearing where they're struggling, I've heard the business owner say that his insurance was more than his mortgage, and we've been able to find people and help them find more affordable options. Having a lot of options is key.
Thank you very much, and I commend the state for your efforts, and I yield back, Mr. Chairman.
Thank you, Mr. Davis. Appreciate your questions. And now, just before I call on Representative Sewell to ask her questions, the gentlelady from Alabama, I would ask Congresswoman Chu to take over the chair just for a few moments. Are you able to do that, Congresswoman Chu?
Yes, absolutely.
You're in charge. The next speaker after Ms. Sewell will be Mr. Kilby, I believe, from Michigan. Okay?
Yes, thank you.
Mr. Chair, I want to thank you for hosting today's hearing. I'm glad we are able to be joined by Andy Slavitt and officials from New Jersey and Colorado, two states that have made great strides in expanding coverage and access. Holding our states accountable for their health coverage choices, I believe, is an imperative. And we should start by focusing on the damage that Republican governors have done to their citizens that did not expand Medicaid. Both of your states have expanded their Medicaid programs. Neither state has had a rural hospital closure since the Affordable Care Act was enacted. Unfortunately, my home state of Alabama has had 7 hospitals to go under. Alabama has some of the highest uninsured rates and a low percentage of folks covered by employer-sponsored coverage. Mr. Chairman, no one wins when states like Alabama don't expand Medicaid. Today, there are nearly 6 million Americans who fall into the Medicaid gap in the 14 states that did not expand Medicaid. They are our hairdressers, our maintenance workers, our fast food workers, our servers, our cashiers. These are working Americans who make too little to qualify for subsidies or to afford coverage in the private market, but too much to meet their state's requirements to qualify for Medicaid. Even with Alabama's bare bone minimum Medicaid plan, what this means is that a single parent of 2 in Alabama cannot qualify for Medicaid if she makes more than $4,000 annually, not monthly, annually, $4,000. To make matters worse, as these Americans work to earn at least the poverty line so that they can afford health care insurance with subsidies, the Republican attorney generals across the states of the same states are also currently denying them coverage in courts, as has been said earlier. One of the greatest injustices is that people who live in the poorest states are left with the worst healthcare access and coverage options because of failed leadership on the state level. The consequences are cyclical and compounding, especially when combined with the global pandemic that has really left people suffering with chronic illnesses, and especially those of racial minorities. I think about a 3rd-generation farmer in the rural part of my district named Hank. He was able to afford insurance for the first time in his life in 2014, thanks to the Affordable Care Act's cost-sharing subsidies. He signed up for a great plan months before he was in a terrible farming accident, he would have lost his arm had he not been able to be airlifted to a Birmingham hospital, which literally saved his life and also saved his family from being bankrupt. Hank admitted that if he knew that it was called Obamacare when he was signed up, he probably would not have signed up when the navigator that knocked on his door told him about the chance to get health insurance through the Affordable Care Act, just months before he needed it. My question is twofold to Administrator Andy Slavitt. First, why is protecting and strengthening the Affordable Care Act important for those who cares about healthcare inequities, particularly in rural communities and underserved Black communities? Can you also talk about the advantages of expanding Medicaid? Secondly, if these Republican attorney generals are successful before the Supreme Court November 10th, would Alabamians like Hank lose their marketplace subsidies? And again, thank you, sir, for all that you've done regarding the Affordable Care Act.
Thank you, Congresswoman. I think the message that people get around the country when their state doesn't expand Medicaid, or if they are not offered affordable coverage, is you don't matter enough to earn healthcare coverage. That you have to either be of a certain social status, you have to be of a certain income level, you have to be of a certain race, you have to live in a certain zip code, and then healthcare coverage is for you. The Affordable Care Act, far from perfect, made an effort to say insurance is no longer about the insurance companies who get to make whatever rules they want and exclude whoever they want, but it is in fact about us as individuals, as families, as Americans, as Alabamians. So it is a vital part of our message that healthcare in this country is not something to be earned. It's something that is our ultimate source of freedom because it allows us to live a better, more prosperous, healthy life. Now, if the court case or anything else were to take away the Affordable Care Act, your constituent and all of your constituents would be back to a situation where they would be uninsured. Now, that wouldn't mean that they wouldn't need medical care. They would just be going to emergency rooms. They would be waiting till their cancer had progressed to stage 3 or 4 instead of getting mammograms. We saw that all over. That was the norm before the ACA, and unfortunately, it would be the norm again.
Thank you so much. Once again, I truly believe that healthcare in this great country that we live in should be a right and not a privilege. Thanks again for all that you've done to help shore up healthcare in America. I yield back.
Okay, the gentlelady's time has expired. The chair now recognizes Mr. Kildee from Michigan for 5 minutes.
Thank you, Madam Chair. And obviously, thank you to Chairman Pascrell for organizing this very important hearing, which comes at a very important time. I have a couple of questions that I want to get into, but before that, I want to just give Mr. Patterson an opportunity to clarify, I think, the way his statement around flexibility may have been interpreted. I assume, Mr. Patterson, you would agree with the notion that flexibility granted to states would be flexibility that builds upon the existing guardrails and architectural foundation of the ACA, not flexibility to get away from those. Would that be a more fair characterization of the position that you articulated, Mr. Patterson? I don't see, or I don't hear Mr. Patterson.
I'm sorry, I didn't have myself off mute, Congressman. Okay. The flexibility is within the context of the implementation of the Affordable Care Act to the best of our ability as a state.
Right, not flexibility to undermine those foundational characteristics of the ACA. I mean, I think flexibility can be interpreted in different ways, and I took from one member that he may have interpreted your point to be flexibility to move away from the guardrails that the ACA provides. And I would want to be careful that that not be a position that I don't believe that comports with the way you have articulated yourself so far today.
I would agree with your characterization of that, Congressman. Yes.
Thank you. I wonder, if I could just turn to Mr. Slavitt for a moment on the issue of pre-existing conditions. In Michigan, before the implementation of ACA, about 11% of our state's population had no health insurance whatsoever. And by 2018, due to ACA, we'd cut that number by more than half. And I'm worried that despite lots of rhetoric and promises, that what some of our colleagues on the other side say, that they want to protect people with pre-existing conditions, they have to accept the fact that they're suing right now to take away all of the provisions of the ACA, including those important provisions. So I wonder if you might talk about some of the damage that would be done, number one, to people with pre-existing conditions, like my daughter who has diabetes, my wife who has multiple sclerosis. And I wonder if you might couch some of your comments in these terms. Even if somehow the purported promise of assuring coverage for people with pre-existing conditions is a genuine one, would overturning the ACA also allow insurers to return to annual or lifetime caps, for example? Would they allow those premiums paid by people with pre-existing conditions to be so onerous that they only have the right to coverage in name only, but can't afford it? I wonder if you might just comment on that in my remaining time.
Yeah, thank you, Congressman. The truth is that if, in fact, the ACA is overturned, Americans would once again find themselves in a position that they found themselves in 2007, 2008, 2009, where insurance companies would not be required to cover them for their pre-existing condition. They may cover them, but they may say your asthma or your cancer or your mental health condition or your heart arrhythmia is excluded. Or they may say, you can have those things, but we're going to charge you an unlimited amount of money more. That's what the discrimination is, and it would affect Michiganders quite directly. In the midst of the pandemic, the situation would be even worse because no one knows what COVID-19 brings in terms of conditions that will come from it. We just don't know yet. And so it is a blanket pass to insurance companies to say, I don't want to cover you again. So for people like your daughter, once again, it would be hazardous for her to change jobs. It would be hazardous for her to disclose to people that she had diabetes, because if she did, the coverage might be excluded. Imagine trying to manage a pandemic with everybody in the country with an incentive to not disclose that they have COVID-19. Imagine trying to contact trace or get people to agree to testing. We would be in even worse shape than we are today.
Thank you, Mr. Slavitt. I think also, if you could just comment on the lifetime and annual caps, what would happen on that score?
Well, a lifetime and annual cap, let's think about what that is. Typically, if you have a $500,000 or $1 million lifetime or annual cap, if a baby is born a few weeks or so early, or if there is a bad case of cancer, that's it. So those are arbitrary lines. Those are lines that the ACA does not allow insurance companies to cross. We're able to eliminate that. It's much more freedom for people, and it's not much additional premium. So that would go away, of course, if the Affordable Care Act is overturned.
Thank you, Mr. Chair. I appreciate that.
I yield back. Thank you, Mr. Chairman.
Thank you, Mr. Kildee, for your questions. And now I call on Mr. Schneider, a gentleman from Illinois.
Thank you, Mr. Chairman. And I appreciate you having this hearing. We're so deluged with many crises that it's hard to know where to turn our energies. But this hearing importantly maintains this issue on the front burner, especially as we fight COVID-19, the COVID-19 pandemic, and consider the long-term impacts that it's likely to have. The Trump administration has taken unprecedented steps to undermine what has been the law of the land for a decade, the Affordable Care Act. Not only before, but during this global health crisis. We've lost more than 220,000 American lives. 8.25 million people are already confirmed to have the infection. And many, if not most, are likely to have lifetime-related effects. In other words, COVID-19 is likely to be a pre-existing condition. Mr. Slavitt, as you noted, early evidence indicates COVID impacts, and I'll quote, our heart, lungs, pancreas, kidneys, brain, and our clotting and immune systems. Mr. Slavitt, you also noted that when you worked in the Obama administration, you were duty-bound to implement the laws as Congress intended. An administration should not pick and choose to enforce the laws they do or do not like. This is true with all laws, but especially problematic when the law in question has proven beneficial to so many millions of Americans. There is no doubt our country's healthcare system is stronger because of the ACA. More than 130 million Americans have pre-existing condition protections. And as already noted, that number will only grow because of COVID. Lifetime and annual caps on coverage are banned for more than 100 million Americans. Free preventive care, expanded Medicaid eligibility. The list goes on and on. These benefits are valuable in normal times, but have proven absolutely critical during the COVID pandemic, where getting care when and where you need it is at a premium. But those critical improvements will be of no value if we have an administration that tries to sabotage the law at every turn. Trump has promoted junk plans that don't cover pre-existing conditions. He's gutted funding and support for enrollment assistance. And as we convene here today, his administration is looking to invalidate the law through the courts. However, less eye-catching, but just as disappointing, is partisan refusal to work across the aisle to improve the ACA. Any law as large and complex as the ACA is bound to need changes and improvements. But for a decade, any significant effort to build on the ACA's successes, fix its shortcomings, and explore ways to improve healthcare for all Americans have only been met with disdain and derision by our Republican counterparts. Improving existing law for the betterment of our constituents should not be controversial, but that has been the political reality for too long. So, Mr. Slavitt, like others before me, I follow you on Twitter. I appreciate your insights. And my question for you is, if you were still serving in the administration, what would be the top improvements you would immediately make to ACA or recommend to us in Congress to improve it for all Americans?
Thank you, Congressman. Look, I think the first thing is to absolutely reach out to the communities that are in need of coverage and assure them that this coverage is available to them, in most cases for under $75, to reach out to young people and to continue to expand the ACA. We had 4 or 5 years in a row where we reduced the uninsured rate from something like 17% down to 8 or 9%, depending on which measure you use. That's gone up over the last few years. If you believe government should be about results, not about actions, then those are the kinds of results that we would have to commit ourselves to deliver again. I'd also work with Congress to correct some of the things that I think Mr. Pope and others have pointed out will improve the law. There are absolutely opportunities for us to make the law better. It was passed 10 years ago. It was not intended to be the final word. It was intended to be a great start. And there are plenty of opportunities if the Congress would work together in a bipartisan way to build on what we have, not eliminate it or reduce it. So I would say that this is what Americans want. Americans don't want both parties fighting over their health care. They want the support in times of need.
Thank you. And I couldn't agree more. We do need to find a way to come together and improve healthcare for all Americans, that they have it as a right, not a privilege, that they can get the care they need from doctors they trust. All of those things are so important. And as my time expires, Mr. Chairman, I will ask unanimous consent to enter into the record the most recent census report showing an increase in the number of uninsured, not a decrease, as was mentioned earlier in this hearing.
Okay, thank you very much. I appreciate that. Enter into the record without any objections.
Thank you, and I yield back.
Thank you for your questions. And our last congressman today is Mr. Horsford from Nevada. You have 5 minutes, and thank you for being here.
Well, thank you, Mr. Chairman, for holding this hearing today. And the reason that I came to Congress and the reason that I worked so hard to join this committee was to increase access to healthcare and to bring down out-of-pocket cost of prescription drugs for Nevadans and people all across the country. And I agree with my colleague and those who've spoken today that we need to improve on the Affordable Care Act, make it work for all people, and address the weaknesses that may exist in order to improve on it. Well, instead of doing that, President Trump has time and time again made it his #1 goal to strip healthcare away from Americans with no plan to replace it. And it is surely one thing when the Trump administration and some of my colleagues on the other side repeatedly sought to repeal the Affordable Care Act, but now, in the middle of a global health pandemic that has taken the lives of more than 220,000 Americans, the likes we have never seen before, this administration is racing, literally, to undermine our healthcare system, one that has already been stretched too thin. So instead of focusing on cutting healthcare to Americans, we ought to be improving access and coverage, because now is the time that Americans need that the most. That also means strengthening our health systems by expanding telehealth for rural communities, protecting our frontline medical workers, and implementing real testing, tracing, and treatment strategies for COVID-19 so no more American lives are lost. Yet here we are again discussing the full onslaught, assault of the Affordable Care Act, which would dismantle Nevada's Medicaid expansion for 371,000 Nevadans. Now, when this bill was passed, I was serving in the state Senate. I worked with our Republican governor at the time. He was the first Republican governor in the country to enact the Medicaid expansion. It was bipartisan because we knew it was important to put Nevada's health above any party. Now, this administration is now looking to strip away protections for over 1.2 million Nevadans with pre-existing conditions, which now include even the coronavirus. So I would like to just underscore that right now in Nevada, because of the ongoing effects of COVID-19 and its impact on the economy, we have nearly 200,000 individuals who are out of work. Many are furloughed or laid off. Currently, they have the opportunity through some of their employers to maintain their health insurance, but some are relying on COBRA coverage until they're able to return to work. That's why I introduced, with the help of this committee, the Worker Health Coverage Protection Act to provide financial assistance to workers and families by covering the full cost of COBRA premiums for people who lost their jobs or had their hours reduced. So, Mr. Slavitt, in your testimony, you shared that there are an estimated 14.6 million people who may have lost their employer-sponsored health coverage. The Commonwealth Fund recently found that in the last 3 quarters of 2020, 1/3 of those who lost employer-sponsored insurance coverage through pandemic-related job loss will become uninsured. So, Mr. Slavitt, if the Trump ACA lawsuit succeeds, what will happen to these Americans? And why do we need to protect the ACA for individuals like those who are covered through their employer-sponsored plans?
Thank you, Congressman. I think 2 things happen. The first is that more and more people will lose coverage and not have a place to get it. And secondly, as they continue, those with pre-existing conditions, including anybody who had contacted COVID, will be in a situation where they may not be able to get coverage again. So we will be back to a situation that is worse than we were even 10 years ago. And I suspect the uninsured rates will go back from where they came down to 8, 9, or 10% up to 15, 16% again, which would be a tragedy for millions of American families.
Well, thank you. And that's why I'll continue to work to make sure we safeguard the ACA and all elections in Nevada and across the country so that they can have access to their employer-sponsored health plan to protect the hard-earned benefits for which workers and families have fought and sacrificed. I thank you, Mr. Chairman, for this very important and timely hearing.
The gentleman's time has expired and all members have completed questioning. So I'd like to thank our witnesses for joining us today. Please be advised that members have 2 weeks to submit written questions to be answered later in writing. Those questions and your answers will be made part of the formal hearing record. With that, the subcommittee stands adjourned.